Well, here we are 1 month into this crisis, and Canadian leaders all appear to agree we still have a long way to go, that the stay-at-home orders and the economic shutdowns will be with us for weeks more. Federal and provincial governments right now talking about when to take the first steps back to normal and how to begin that journey. All of that, let's bring in Laura McQuillan right now as she's on our top story this morning. And Laura, let's begin here with the World Health Organization because it is laying out a bit of a roadmap for governments around the world to follow. What are the guidelines that they're talking about?
That's right. They are beginning to see governments around the world wanting to move towards reopening. In fact, lifting lockdowns now, and they want to make sure that's done in a safe way. So these 6 guidelines were released yesterday. We can show you what the World Health Organization said. Now, they want governments to make sure transmission is controlled, that there are only sporadic cases or clusters, small clusters, and that the health system can cope with whatever pops up in future. All cases should be tested with results within 24 hours. That's those health system capacities, and quickly isolating those people as well and tracing who they've been in contact with. Also, minimising those outbreaks in high vulnerability places. We're talking about long-term care facilities. Other measures include making sure that workplaces have their own measures in place, steps like physical distancing, even temperature monitoring that will be individual to every workplace, urging governments to monitor and potentially quarantine travellers, and making sure the public does its part, which will be really important, that physical distancing, that extra hand washing that we've all been told to do. Now, on these points, we've taken a look at how prepared Canada is, and on most of the guidelines, not very right now. Now, the rate of testing remains low. There are still delays getting results, but of course that new rapid testing device that's been approved by Health Canada will help speed that up. But you look at the risk to nursing homes, those deaths account for nearly half the deaths in Canada, so still a high risk there. And also, how are businesses, schools and borders going to be reopened in a safe way? For an answer on all of this and the potential risk of reopening too soon, we spoke to Dr. Tim Evans. He's the head of McGill University's School of Population and Global Health.
The risk is the risk we've just incurred, which is we fly blind, right? We're always reacting and trying to catch up. And I think we really can't afford to be only reacting. We have to be much more proactive, and we don't have any excuses now.
So obviously a lot to consider when it comes to this country and how we get things back to normal. But it is interesting to look overseas right now because we're starting to see some countries beginning to lift restrictions, trying to get back to normal in their home countries. So how are those efforts playing out?
Well, some of the countries that are being looked at right now are in Europe because there are several countries there that are moving towards lifting lockdowns, including Austria, which yesterday allowed thousands of stores to reopen a month after starting its lockdown. Also, Italy is reopening some stores that sell children's items, though its worst hit regions are holding off for now. Spain letting construction workers back on the job. China, of course, began lifting its restrictions weeks ago, lifting the lockdown in Wuhan earlier this month. But now China seeing a second wave of cases imported from abroad. With all of that in mind, we heard more from the head of the World Health Organization urging restraint and patience from public as countries move forward with this, or rather as they wait to lift these lockdowns. And here's what he said.
I know that some countries are already planning the transition out of stay-at-home restrictions. WHO wants to see restrictions lifted as much as anyone. At the same time, lifting restrictions too quickly could lead to a deadly resurgence. The way down can be as dangerous as the way up if not managed properly.
And the message from the World Health Organization was each phase of lifting the lockdown should be staggered 2 weeks apart. As you can imagine, Michael, that would take months.
Laura, thank you for that. So what are Canadian leaders doing? Right now, we know that they are consulting with each other and working up plans. But as David Cochrane tells us, they say that restarting this economy won't be a matter of just flipping a switch.
It's the big question.
I know that everyone is very interested to know when things are going to get back to normal.
For which there is no definitive answer.
The reality is it is going to be weeks still.
with massive uncertainty everywhere in Canada.
You tell me how long the pandemic will last, I'll tell you how long. I don't know.
It is really premature to even think about that just at the moment.
If we had $1 for every time Heather and I were asked this question,
those would be some of the few dollars moving in an economy largely locked down to essential services. Saskatchewan says it may soon release a plan to reopen its economy, but warns even with a plan, it won't happen quickly.
There is no magic switch that we can flip that sends everything back to normal overnight.
There have been some exemptions beyond core essential work in sectors like construction, but nationally there are still too many cases. And with each province on its own epidemic curve, there are still too many hotspots, too much uncertainty for serious talk about an economic return to normal.
There's no rule book on this. There's not a book that I can pull off the shelf that tells me how do I deal with a pandemic.
Even the Premier who boasted that Ontario was open for business is determined to keep it closed.
I'm not going to jeopardize people's health to open up the floodgates.
So the gates stay closed for now, and when they do finally open, it will be done slowly, with caution, and coordinating as much as possible with the provinces.
We will have to do it in phases. We will have to remain vigilant until such a point as a vaccine against COVID-19 is found.
A vaccine would allow for definitive answers, but that is still, at best, months away. David Cochran, CBC News, Ottawa.
Well, staying in Ottawa, the Canada Border Services Agency is temporarily reducing service at more than 24 crossings tonight at midnight. Now, the CBSA says the changes will happen at 27 low-traffic ports of entry, most of them in Western Canada and Quebec. Right now, the border is shut down to all non-essential travel between Canada and the U.S., the Prime Minister saying those travel restrictions are likely to stay in place for weeks to come. And Ottawa's new mandatory quarantine rules for returning Canadian travelers are now in effect. Those coming home from abroad now must have a credible plan to self-isolate, and if they do not, well, they will be forced to stay at a quarantine facility like a hotel. Returning travelers must also wear a non-medical mask or face covering before they proceed to their final destination.